Okay, hi there Sean. So you're here today to tell us about your experience in your second MACP clinical placement. But before that, do you want to just tell us a little bit about yourself and why you wanted to do it and everything?
Okay, yeah, sure. So I've been a physio since 2001, so when you think about that, 13 years. I've been an outpatient for about 8 years. I specialised in neuro first of all. I work at Western Sussex Hospital Trust, so that's the Worthing Hospital down on the south coast. I work in a nice, dynamic, forward-thinking department, very supportive of the MSc process. There's 6 or 7 people that have completed the process, and there's 3 or 4 of us going through it at the moment. So it's a great place for supporting that and making it happen, really.
Good. So how did you feel before starting the placement?
Well, my second placement felt quite different to my first placement. I was quite anxious and uncertain and how the first placement would be, being observed continuously and having your practice critiqued so much. And
it's hard.
Yeah, exactly. And I had very little observed practice prior to that. I came from private practice, so quite used to work on my own, isolated. So that was quite a big challenge.
Yeah.
Having got through the first placement and found how much benefits it brought. Going to the second placement, I was in a different place. I was looking forward to having all that attention and someone observing and discussing your practice and taking it
questioning
apart.
everything that you do.
And so I was ready for that, and I wanted it rather than kind of not being sure how it would feel, because I know the benefits it brings. So it's challenging, but when you see
and very tiring.
Yeah, that's right. Yeah, exactly. So mentally,
Okay, so what helped facilitate your learning, do you think?
So I had written quite some notes during my first placement about the things that had come up, that had thrown themselves up, quite obvious to me, but also that my educators had highlighted. And I looked at those to see if they'd changed over the period of time between the 2 placements. It's about 15 months, 18 months from 2 placements. And then so I drew up a list of things that I wanted to work on the placement. And then I asked the educators on the second placement to also bring up what they thought I needed to work on, and then trying to match those lists together, really. So I think I was more proactive in my learning. I knew what I wanted to get, rather than on the first placement I was kind of waiting to find out what needed to be dealt with.
Being told what to do and things rather than... No, that's really good. So can you give an example of a patient, maybe an interaction which helped you move forward in your practice?
So I had a chap who was referred with unilateral mid-thoracic scapular pain. He had it for 10 years. He'd been having regular 6-monthly injections at the pain clinic, which helped for 3 or 4 months. They decided to stop doing those, so he was referred to physio to have the problem looked at. It looked quite clearly like a nice cloud sign referral. I could bring it on quite clearly from his neck.
Cloud sign?
So that's some early work.
Just explain that. What does that mean? Cloud sign?
So it's...
I haven't come across that before.
Okay, so it's work done by Cloud back in the 50s when injected people in their cervical disc.
Someone's name.
And recreated these localised areas of referral along the thoracic side.
Is it Cloard?
Yeah, it might be. I probably pronounced it a bit wrong.
Sorry, I know it's Cloard, but fine. Sorry.
And so throughout his subjective, he brought in this homemade device he'd made to self-massage the spot that hurt. And so I could bring the symptoms on from his neck, I could change him through treating his neck, but at the end of the session he wasn't happy, and I think it transpired because I hadn't palpated where it hurt, I hadn't validated that area of pain for him. It kind of threw open the door that actually I hadn't provided...
He didn't believe you.
He didn't believe me. I hadn't provided a differential diagnosis. If I palpate the area pre-treatment and then post-treatment, that would also be extra evidence to support that treating elsewhere was treating a referral pattern, not a localised source. So there was a real kind of, light bulb moment of, okay, right, so this is...
You have to get the patient on board and, get him to believe what you're saying.
And then also the evidence for me. So, so you can recreate this pain for referral, but is there a local source as well? Does palpation change pre and post treatment? So it's that pre-treatment evidence, post-treatment evidence that actually gets both you and the patients
Yeah.
on the same pathway.
Great. Fantastic.
Yeah, so
Yeah.
that was a really clear learning thing.
Good. Okay, I think that's going to be really helpful. Thank you very much, Sean.
Okay.